two, one.
Today, we will be talking about different various wellness and social practices. Social practices have shaped ideas of wellness in several different ways, such as the foods that we eat. We are advised to eat less fat and sugar in our foods, and eat things such as vegetables and fruits, which are found to have vital minerals and vitamin and antioxidants in them. Exercise has also been suggested that we move at least 30 minutes a day and that each person should sleep at least 8 hours in order to receive a more rested mind and body. Wellness has shaped social practices in different ways. Healthcare professionals, for instance, again, have advised 8 hours of sleep a night to have the most effect use of our brains. Researchers and medical professionals have also found a connection between processed foods and disease, such as cancers and obesity, heart disease, when using various food dyes and preservatives. They have been found, and chemicals have been found to cause disease when they're processed versus natural foods. And also the importance of exercising to reduce obesity and heart disease. Topics we have discussed that have shaped our ideas. Something as simple as being unable to afford medication can actually have a snowball effect on at least three different wellness aspects out of the eight. For instance, if someone loses their job and they can't afford the medication for, let's say, asthma, well, the financial is already suffering because of the loss of the job. The physical is going to suffer because without the medications, the person cannot stay well and the disease cannot be managed. And the spiritual aspects can also cause a person to feel low or feel morally wrong, or that they may not have any support, or if they are spiritual, they may feel low in spirit, or that no one is there for them and that they're on their own. There's emphasis or lack of emphasis on societal wellness and everyday change of individual or societal behavior. For instance, on our right, we see the doctor and the patient, and the doctor may decide to give you recommend weight loss. Well, that is a very good recommendation. However, socioeconomically, it may not be possible. For instance, if you are on a fixed income or if you don't make as much money, then organic foods and the different things that are suggested that are healthier to eat may not be possible for one to purchase. Also, we have to take into effect of limited mobility. We have people because of different various reasons, diseases, injuries, they may have limited mobility and they may not be able to exercise or do cardio activities. How has wellness influenced behaviors in my study discipline? I spent over 15 years in healthcare, the last few years in psychiatry, And wellness has influenced behaviors in psychiatry in a couple of ways. People are now being encouraged to seek psychiatric help instead of living with shame and fear of mental health stigma. Groups like NAMI, National Alliance for the Mentally Ill, are working to reduce and eradicate eventually social stigma in the mental health community, and are being encouraged through various outlets, even at various schools. Jobs have various programs, assistance programs, where one may receive 5 counseling sessions if need be. So we want to encourage people to think about their mental health, because mental health is also part of health and also part of wellness, and it's very important. There are positive and negative aspects of things in wellness that were discussed. And you have positive things such as prayer. Prayer and meditation can keep you connected to a higher being. Things like community activities, community involvement can give one a sense of purpose, and so can having a good support system. So it's very good. Friends, family, church family, or club members, or wherever one can find a good support system is very important. And also, staying physically active, physical fitness, and physically active, it reduces our weight, keeps us at a healthy weight. It also reduces what we call feel good endorphins in the brain. So it can also have a good effect on depression and anxiety. And those things are always really good. And also reduce things like heart disease and certain cancers, and maybe even improve arthritis. But we also have negative aspects and things that challenge wellness. For instance, heart disease. Heart disease can challenge wellness because you may not be able to be as active as you want. Um, Medications have to be taken. Sometimes you have to weigh yourself every morning to make sure that you're not retaining fluid. And so it's very important that you keep cardiac issues under control. And also, if you're surrounded by negativity or a negative environment, which could be detrimental to one's mind and spirit and well-being, because they've shown in the past where people that are in negative environments tend to have different diseases, and sometimes their own outlook on life becomes negative. And so that greatly affects wellness. And also, when it comes to spirituality, some people have had bad spiritual experiences. For instance, condemnation and extreme judgment in religion, in certain religions and in church. And they may now have a generalized idea that all religion is bad, and they may have a stigma against church in general. Also, we cannot forget social awkwardness. Many people are socially awkward. They don't know how to hold conversations. They don't know what to say if someone asks them anything, or they may think that everyone's watching them, or everyone's laughing at them, which completely may not be the case. But this is in the mind of this person. So these are things that challenge wellness. Also, emerging technologies that can help improve social and societal wellness. For instance, we have different cell phone apps, fitness apps. One can record heart rate and anything else. You have electronic medical records, and you also have game systems where the whole family can get involved. These are all things that can improve social and societal wellness.